Hi, everyone. I am Grace Lee. I'm candidate running for New York State Assembly in the 65th District. And today I am here with Dr. Elizabeth Alexander, who is an infectious disease doctor who is going to speak to us today about COVID-19 and the coronavirus and some of the concerns we have about the disease and to learn more about how it's affecting our community.
I'm an infectious diseases doctor. We are the doctors that treat infections. We do not necessarily track infections, those are epidemiologists, but we are the doctors in hospitals who are called in to give advice on treatment parameters or specifically around infections.
What is COVID-19 and why is it so dangerous?
Yeah, so COVID-19 is a novel coronavirus. The disease is called COVID-19, and the virus that causes the disease is called SARS-CoV-2. SARS-CoV-1 is the original SARS that was back in China and East Asia a while ago. And this is a new strain of a coronavirus, which are viruses that usually cause the common flu. There are typically 4 strains sort of in and around the circulation, particularly during the winter months, and they cause, your regular seasonal cold. But this is a completely new one in that none of our immune systems have ever seen it before. And that's why it is so able to cause disease and spread so quickly and cause such disease. This virus appears to have arisen as a result of a crossover event between bats and pangolins, which are this kind of armadillo-looking mammal, and then spread to humans. And this crossover event is thought to have possibly occurred in wet markets where these animals are sold for meat. So this virus can cause anything ranging from symptoms akin to the common cold or flu, all the way up to very severe disease. The most common symptoms and the ones that we frequently hear about on the news are fever, shortness of breath, and a dry cough. But there are other symptoms that have also been seen with this as well, including a non-dry cough, so a productive cough, sore throat, runny nose, nausea, vomiting, muscle aches and pains, and fatigue and headaches are also symptoms that we can see with this.
A lot of these symptoms sound a lot like the flu or a bad cold. So how are people actually supposed to know whether they have it or not?
Yeah, it's very difficult to know whether you have it or not, and it's difficult even for the medical professionals to know whether you have COVID-19 or whether you have one of the other seasonal colds that's in circulation right now, or whether you have the flu. You have pretty classic symptoms of fever, shortness of breath, and a dry cough. Because we really don't have enough tests right now, it's probably best to just assume that you may have this and stay home and self-quarantine.
Can you talk about why it's so important to social distance and to self-quarantine?
Yeah, so self-quarantine is different than social distancing. Self-quarantine actually means you're going to put yourself in a dedicated room in your house, ideally with a dedicated bathroom for just you, and try to stay away from the rest of your own family as much as possible. If you have symptoms, that is really the best thing to do. And it's really important that everyone try to do that to avoid getting your family members sick and then other people beyond your own family sick. So social distancing is basically trying to keep your family unit distant from everybody else. When we go outside, it's for walks around our block, and we're trying to keep a distance of 6 feet or more from anyone else at all times. really important that people try to adhere to that as much as possible as we try to do what we call flattening the curve. We're trying to slow the rate of infection to decrease the number of people with the infection at any one time. And the reason we need to do that is right now our curve looks like this. It's going straight up, and we have too many people with this infection for our hospital system. And we are threatening to overrun our hospital system.
How long we can expect to have to be out of schools, out of our offices, and staying home?
We're really on a taking it day by day basis. We're here on the curve right now. Things are changing literally every 12 hours, if not more frequently. So I think we've just got to watch and wait. I know people are very frustrated. I know it's very difficult to be just staying at home right now. Everyone's feeling very overwhelmed, and this is a truly stressful situation. But we really need to adhere to social distancing during this crucial time. The virus is on the virus's timeline. The virus is not on the president's timeline. It's not on my timeline. It's not on any of our timelines. It's on its own. And we are subject to its timeline, not the other way around. We need to continue to have the social distancing until we have seen evidence that we are flattening the curve. We are not expected to get anywhere near the peak of the curve until May 1st. Now, that doesn't mean that May 1st, all of a sudden everything opens up. After you shut everything down, even if you've effectively shut all transmission of the virus, that you have to wait to see that peak, and then it starts to go down. So we're really not looking at a matter of weeks here. In my opinion, we're looking at a matter of months.
So is it possible that we could come out of social distancing and then come back into it again later in the fall?
Yeah, and then that is actually what I personally believe will happen, and that people sort of need to brace for and kind of set their expectations that this is not going to just go away and then we'll never have to deal with it again. It will probably go away and then it may come back.
Where are we in that process of developing a vaccine?
As Tony Fauci has said numerous times, and as someone in clinical research, I can attest to the veracity of this. It is going to be at least a year and, potentially a year and a half before we likely have a vaccine for this. There are a number of other drugs, including drugs used for HIV, other antiviral drugs that were developed for influenza, and other antiviral drugs developed for treatment of other viruses that are being looked at in COVID. And on those, it's very similar. We really need more data. I will say that I'm hopeful that we will see data on a treatment before we have a potential vaccine candidate, just based on the rapidity at which information is being spread between doctors. One of the few good things about this is we are sharing information with each other at a rate and to a degree that I never thought possible in my medical career. The medical community has really come together in this. So, that is one of the few bright lights during these dark times. But I think it is going to serve us very well.
People have said that you can be contagious before you even show symptoms. Is that correct?
Absolutely. That is absolutely correct. Average incubation period of the virus, the time it takes from when you've actually been infected to when you show symptoms, is 5 days. It ranges from 2 to 14 days. So that's why when we say, if you think you've been exposed, stay home for 14 days and self-quarantine for 14 days, because that's the upper limit of by when you should develop symptoms and know you likely have it if you have been exposed. About 80% of people who get COVID-19 will have a mild disease, between anything sort of resembling a common cold, flu. It tends to be primarily fever, dry cough, and shortness of breath, but there are a barrage of other symptoms.
Do you think we'll get to a point where we'll be able to test more people?
But I do think that we will be able to ramp up testing. I think we actually already are ramping up testing, and I do think that that is why we've seen that rapid increase over the past 2 days, such that we've now overtaken China. And that's why our mortality percentage is as low as it is. That we've ramped up testing. We're finding a lot of these either asymptomatic or mildly symptomatic individuals.
We hear a lot about washing hands, and that, as being one of the most effective ways to not spread, and not touching your face, of course.
Yeah.
But what about the gloves and the mask?
Yeah. The virus is spread 2 main ways. It's spread through respiratory droplets, and it's spread through oral fecal route. Basically hands and mouth. We know that the virus can live up to 3 days on things like stainless steel, plastics. It can live 24 hours on cardboard, and it can be airborne for about 3 hours. So putting on a mask is really not necessary because as long as you're 6 feet away, as long as you're social distancing, it's not going to buy you that much more. Wash hands, wipe down surfaces with bleach or with Lysol, especially those that are frequently used. That is enough to keep you safe and save the masks and the gloves for the doctors and nurses on the front line.
Someone in their 30s has just passed away from the virus, or from, due to complications from the virus, or someone in their 40s or even in their 20s. So can you speak to that a little bit?
The elderly tend to have an increasing rate, an increasing odds ratio for severe disease, meaning an increased risk, depending on each decade older that they get. This doesn't mean, as you said, that young people are somehow immune or don't get sick or don't get severe disease or don't die. Young people cannot think that they are immune. They absolutely are not. They can absolutely get this, and they can get very sick from it. Or they could pass it to someone older or with underlying medical conditions who could also get very sick from it.
So once you get it, do you build up an immunity to COVID, or are you able to catch it again?
Right now, we believe that you are immune, although there have been a few cases of recurrence. So we're not really sure, but we do believe that there is increasing evidence that you do become immune to this. Right now, we're actually requesting people who have had COVID-19, know they have had it, and have recovered from it, can go on, among other things, the Mount Sinai website and sign up to donate their serum. Researchers will be collecting their serum, their blood, and looking for antibodies to see if they can give those antibodies to patients currently with the disease.
Any other additional thoughts or comments to people watching this video about, staying in, or just how to stay hopeful during this time?
Reflecting on the incredibly hard work, the incredibly courageous work being done by all of those on the front line. I think about that all the time, and that their courage gives me courage, and their strength and resilience gives me strength and resilience. And I think the best way that we can show our support for them is by doing our part in terms of social distancing and trying to stay safe ourselves.